Hi, it's Dr. Dumestre, carrying on with my discussion on recovery after DIEP Flap reconstruction, and this was in regard to drains. So typically I will use 4 drains for a DIEP Flap. I use 1 in each breast, 2 down in the belly. If it's an immediate DIEP Flap, meaning the DIEP Flap's done the same day of the mastectomy, often those drains stay in for about a week, sometimes longer. If it's a delayed DIEP Flap, you already had your mastectomy and now it's just a second stage. Usually I can get those drains out for you before you leave hospital. The belly drains, they don't come out at the same time, so they communicate to the same space. So I'll remove the first drain usually around a week or so, and then the second drain around 2 to 3 weeks, depending how much fluid output you have. So that leads me to what is the purpose of the drains. So anytime you've got an empty space, so in the case of the breast, you've lost the breast tissue, there's now all that space, and there's all of that space in between the flap and the breast gland. And then from the tummy perspective, when we're closing the DIEP Flap, I have to lift up the skin from belly button to here and then pull it down so it's nice and tight. So then all of that inside is a new space. So your body responds by filling it with fluid. The drains help to wick that fluid away, and so your body doesn't have to be responsible for all of that fluid absorption. What happens when you needed a drain but you don't have one is your body produces all of this fluid, it can't absorb it, and then you end up with a seroma or a fluid collection. That then needs to be aspirated and then sometimes have a drain placed regardless. So they're a pain. People really don't like the drains, but they do play a fairly crucial role in ensuring a smooth healing course. I'd say risk factors for having your drains in longer is larger breast, larger abdomen, tend to produce a little bit more fluid. Have a great day.